Spencer, welcome to Moving Beyond. You know, the other day I ran into a quotation that you probably remember by Albert Einstein, in which he said that we cannot solve our problems with the same thinking that produced them. And that got me wondering about its application to things like our health and well-being. Now, one way of talking about it, I decided, was to think about an issue specifically, like low back pain, one of the most common reasons people seek medical attention and alternative practitioners' attention in our country. So we have back pain and we want no back pain. Back pain, no back pain. It's really the same level of thinking, but there are times when that may be exactly what you need. Let's say that you go in and you get diagnosed. There's marvelous imaging processes available these days, and the doctor comes back and says you've got a ruptured disc at L5S1, right where your lower back articulates with your pelvis. And they do an operation on it, you get over the surgical wounds, you get the anesthesia out of your system, you feel much better, and that's a great outcome. Or it probably is a great outcome, because it is all too common that given a year or two later, that same person may be back in with a back problem at the next level up or somewhere else. And it's not just bad luck on their part, but it's a limitation in the way of thinking about the problem, because sometimes you need a bigger thought umbrella that encompasses pain and no pain. For example, in my 28 years of practice in the Feldenkrais work, it's almost universal that I find people that have low back pain have some degree of stiffness in the chest or the upper back. Now that's important because without the mobility through the system, the forces are not distributed through the system like they should be, but they get funneled into the area that moves best. So a person with a stiff chest, stiff upper back, still is maybe going to go play golf, they're still going to roll pie crust, they're still going to do all the activities of life. But the upper part of them does not participate in the way that it's designed to do, and it funnels the forces into the low back, which is made to move excessively and to absorb all of the wear and tear. Now, if we don't do something about that, if we stay with the pain, no pain level, things continue to be dangerously organized for that person. So we want to look sometimes at what are the factors that go into producing that, and we need to do something about how people move, about how they use themselves, about how they can detect where they stiffen themselves and help them to find other ways of moving. And if we do that, so these forces are no longer funneled into the vulnerable areas, there will be less wear and tear. Now, wear and tear is going to get us all sooner or later. It's either going to be more or it's going to be less, but let's make it later and let's make it less, okay? Now, we need to know when to choose paradigms. So when I broke my leg, I didn't want to go to a Feldenkrais practitioner. I wanted to go to an orthopedic surgeon. And I had a result. I had fractures and I wanted no fractures, and I did not care that these are on the same level of thinking. But many, many other things in life, we need this bigger thought umbrella that deals with the factors that go into creating the local problems. And if that's something that we need, neglecting to do that keeps us always looking for the next surgery or the next pill or the next magical intervention that's going to take those problems away. But it isn't magic. What we need to do is find out how we move, how we contribute to the wear and tear, and to determine that it doesn't have to be that way, that we can find our way out of there through learning and through movement and through reorganizing how we do what we do. All right, just something to think about. I really appreciate hearing your comments, your questions, your critiques. If you want to do that, you can just respond to the email that carried this video to you, or you can look at the contact information that will be on the screen in a moment. So, once again, in the words of Star Trek's Mr. Spock, live long and prosper, and we'll see you next time. Thanks.